just the
Well, good morning,
audio.
everybody. Thanks for joining us. As some of you might know, I'm Tony from Mercy Perrysburg Family Medicine. As we do the third Wednesday of each month, give a talk on a different medical topic. And today we have two speakers. We have Dr. Marquez, who's our family medicine physician, about to enter her third year of residency in about a week and a half. And then Robbie is our pharmacy resident that is just finishing up with our program as well. Today, we're going to talk about managing pain. As we get older, certainly it seems like we get more aches and pains. The question becomes, what do we need to do about that pain? Some people can live at a pain tolerance level for the rest of their lives. Sometimes it's more significant. Pain is subjective. What is painful to me may not necessarily be painful to Robbie. So Dr. Marquez is initially going to talk about different types of pain. And I think it's nice for that to come from a physician perspective. And then she's going to turn it over to Robbie, who's going to talk about pain management techniques, medications, and things of that nature. So I'm going to turn it over to them. We'll stick around in case you have any personal questions.
Thank you. So I'm Dr. Marquez. Nice to meet you guys. Thank you for coming to listen to us. We're talking about pain, so it's one of those topics that I think is important, and honestly, at any age of our living, because I live with chronic pain myself, and I'm quite young. I would just say, but pain does usually worsen as we get older. We get more of this achy pain, so it's really important to know what pain is. Pain is just a natural thing in our body that kind of alarms us that something is wrong. Pain is not technically normal, but it's also not abnormal after a certain point. So we talk about different kinds of pain, and it's important for people to kind of see the different kinds of pain that we as doctors try to figure out. So we ask a lot of questions when you come to visit us at the doctor's office that I'll go with you guys as well. So there's two kinds of pains that we experience, or two categories of pain. We have something called nociceptive pain and neuropathic pain. Not something that you need to memorize at all. But nociceptive pain is more like that muscle pain. It can come from an organ, like your kidney pain. That's known as a nociceptive. And those type of pains are more described as like a dull pain. It can be described also as like an achy pain, sometimes even sharp, depending where it is. So like chest pain when you're having a heart attack, they describe as a sharp pain. If you're telling me you're having a burning pain, we're looking at something else. It kind of guides me to see what else is out there that could be causing the pain. Then you have a neuropathic pain. So this is what you see like in patients who have like sciatica, diabetics who experience diabetic neuropathy. This is more of a tingling, burning pain. So very different. So if you're telling me you're having a burning pain, my mind's going to go to this is something that's in the nerve. And there's a lot of pathologies or etiologies that I need to think about to come up with that. So when we talk about pain, there's also acute pain and there's chronic pain. Acute pain means it's an onset within the last 6 months. This is kind of occurring. It's new. It's a new pain. I don't know what's going on. We need to address that. Chronic pain, you're looking more like arthritis, something that's been going on past 6 months and could go for years. So we look at arthritis pain of all sorts. That's kind of an example of something that's called chronic. Our job as doctors is not to relieve pain at 100% because we wish we could. We are here to alleviate pain for the most part. Acute pain, we have more chances of resolving depending on what kind of pain it is. So if it's coming from an organ, if your kidneys are inflamed by an infection or something, that's easy, I can kind of fix that. But coming from like a joint pain is a little hard. So we have different modalities of how to deal with these pains, which probably we'll get into in a little bit. But when you come to see in the visit, we're gonna ask questions. It's important for me to know where your pain is, how long your pain has been going. Does your pain go anywhere else? Does it radiate? Does it stay local? It's just in my elbow. No, it's in my elbow, but it goes down to my fingertips. That's different. Just by telling me that that does that versus the other one, there are different things I can think about. What makes it better? What makes it worse? Have you tried ice packs, heating pads? You know, that makes it better. Then I know there's some sort of improvement in where we can go from. Let's see. We talk about the duration of the pain. Is this pain coming and going, or is this something that is just It's worse in the morning, but it gets better throughout the day. That also kind of guides us in our diagnosis. And I'm sure you guys all have seen, like on a little piece of paper, we always ask pain from 1 to 10, 10 being the worst pain of your life. Well, this is very subjective. This is something that I cannot rely on except when I start treatment. Because if today you're telling me your pain is a 7, and I start you on some sort of treatment, whether it's like physical therapy or it's actual medications, I see you next time, you're telling me now your pain's a 5, I know it's working. If you tell me today your pain's a 10, then something's going on. It's not working, it's getting worse. And that's kind of what we use that scale for. It's not to really detail the pain that day that I see you with, because what's a 7 for you might be a 10 for you, or vice versa. Okay, so I'll let Robbie take over some medications that we normally commonly use.
Absolutely. So we talked about pain, we talked about all the different things that go into pain, right? You know, on that last page, before we kind of start here, the how to describe pain. As Dr. Marquez was saying, super important to be able to describe the pain so she can understand how to treat it, right? Now, before starting any meds, even the over-the-counter meds, they're right there. Why not just start them? Still want to talk to your doctor beforehand. They're generally safe, but may not be the most appropriate med and may not be safe in your case for whatever maybe reason. So always talk to the doctor before starting meds. Now with that, we'll kind of talk about some of the over-the-counter medications that we have. So the first one is kind of our acetaminophen or our Tylenol that we kind of know it as, okay? It helps with mild pain. It generally is safe for most people as well. But I want to kind of caution you guys because Tylenol comes in first different strengths. So you have the 325, the 500, or the 650, right? All different strengths. And with that, different directions for how to take it. So maybe you can take 2 of the extra strength 500s, but only 1 of the arthritis strength 650s, or something along the lines of that. So always knowing, well, first of all, there's different strengths of Tylenol. Second of all, knowing that Tylenol as a brand name and as it in itself, got to be a little bit careful because there's many different products of what they call Tylenol that has extra ingredients in it too. Okay, so the one we're going after is that generic, that acetaminophen. That's the pain reliever that we're talking about. But some of the Tylenol products may have other things like this Tylenol PM, for example, that has a sleep aid with it. Okay, something very different. Or there's these different cold and flu versions of like Tylenol, for example, as well. So got to be careful. And when in doubt, always can ask a pharmacist, ask anybody, just say, hey, I'm just having like mild pain. I was going to do a Tylenol. Is this the right thing? Just to make sure it's not one of those combo products and then make sure that it's the right strength for you as well. Now we'll kind of move on to the next part here. So keeping going with our over-the-counter medications, we have, don't get overwhelmed too much, just the page. We'll go piece by piece, right? So we have our, what we call our non-steroidal anti-inflammatory drugs, or maybe you guys have heard of NSAIDs before, perhaps, okay? If not, common examples of an NSAID or anti-inflammatory drug like that would be like your Motrin, your Aleve, your Advil. Maybe those ones sound a little bit more familiar, okay? And the generics for those, of course. So we have different oral ones that we can do, like ibuprofen, which is the generic for Aleve and Advil, or not Aleve, Advil and Motrin. And then we have naproxen, which is basically the generic for the Aleve there, okay? They work generally pretty well. They can reduce some inflammation, which can help with pain, but we gotta use caution with these ones. So as I talked about, mention it with the doctor before starting some meds, especially these NSAIDs, right? If we're on blood thinners, if we have stomach problems, or if we have any kidney issues, right? They can be a little bit more scary, okay? So always wanna talk to the doctor before starting these or thinking about them. They do come in topical formulations though. So we talked about the oral ones, right? There is actually like a gel, right? Voltaren. I don't know if you guys ever heard of Voltaren gel before. It comes in an orange box, okay? The generic is diclofenac. And it's actually really, really good for like arthritis, specifically pain, like in the elbows, the wrists, the hands, the knees, the ankles, the feet, that kind of area. And it's a topical gel. Yeah.
Say that again, what was it?
Yep, Voltaren is the brand
Voltaren,
name for it. It comes in an orange box at the pharmacy. And the benefit with this is that since you're not taking it by mouth and it's not a pill, the thought is that it's a little bit safer for you, a little bit less dangerous. Still talk to the doctor before starting it though, just to see if it's the right option for you. The other thing is if you do consider to take the Voltaren and that's something you want to do, there's this weird kind of dosing card right here. So it's not like a normal gel where you can just kind of squirt some out and then put it on the area. There's actually a dosing card that you need to use. And so like if you do decide to use one of these and you're going to do something on the upper body, you basically would take the gel and you kind of squirt it along right here. And then you take from there and just put that on the site right off the dosing card. Lower body, you'd use the lower one right there. So you squirt along that strip and then put that on the site.
And that's on the box of the actual.
When you get the box, that dosing card is in there. So just something that commonly patients I'll have come up and be like, well, I don't know, I put a whole bunch all over. I'm like, okay, let's talk about that dosing card. So that's something just to kind of keep in mind if you did do it. Now, there are other topical things for pain as well. There's like lidocaine patches that kind of numb some pain, and other things like that can kind of help. But again, best thing is to ask the doctor and help describe that pain so we know what option is best for you, okay? Because if the pain is a certain type, then maybe these won't even do anything, okay? Now, there are prescription-only medications. There are other NSAIDs. So we talked about ibuprofen or like the Advil, the Motrin. We talked about Aleve, right? We talked about those are over the counter. There are prescription-only versions of those, okay? Like diclofenac or meloxicam. Don't worry about the names too much, but there are prescription ones that can work better. But again, the same risks, okay? About the stomach stuff, the kidney stuff, if we're on blood thinners, the same kind of risk that we talked about before. And of course, if it's prescription, you're going to be talking to a doctor anyways. Now, as we talked about, right, describing your pain to your prescriber is one of the most important things because then we know what type of pain, hopefully, that it is, and then we know how to treat it because then we have certain nerve pain medications, right? If it is that burning, that numbing, like that numbness, that tingling that we're trying to treat, something like a Motrin isn't really going to do that, right? That's not going to touch that. So we have other medications. Don't worry about the names of them, but they can be helpful to relieve some of that actual burning, tingling, numbness, right? So prescription medications specifically for nerve pain. Now, in the cases of much more severe pain, we of course have opioids, right? They are out there. Things like oxycodone or Percocet or Norco or things like that for very severe pain. Okay, we try to reserve those. They're very high risk medications. And some important points kind of at the bottom of that page are just, of course, they can help with serious pain, but they definitely come with risks. Okay, what we don't think about is it can really cause constipation. These opioids can. Okay, that's a major thing. They can cause really, really significant dizziness, tiredness, drowsiness, to the point where it can increase risks of falls, okay? So they're kind of dangerous on that side of stuff. And of course, opioids have the risk of dependence, addiction, and things like that as well. Now, because of those risks, safe handling them, if you ever have opioids or if you ever get prescribed opioids, safe handling is super, super important, okay? Keeping it out of reach of children, making sure kids can't get a hold of them because that could be extremely dangerous, okay? Keeping them up, locked away. And then of course, if you have any left over that you didn't use, knowing how to safely get rid of them, right? So we can't just throw them in the trash because if a kid goes through the trash or somebody's doing the trash, there's a risk, right? So knowing how to get rid of those safely by like a fire department, police station, something like that is always the safe way. Now, there are other different ways to manage pain as well. Again, it does depend on that type of pain itself. Some people swear by acupuncture and say that really, really works for them. Hot or cold packs. Some people really just swear like, yeah, you know, the arthritis acts up, but I put some ice on it and it goes away, or some heat on it and it goes away, right? Massage therapy. Exercise. I know the class across from over here was doing a bunch of exercise earlier. Yeah, exactly. And so what they found is, you know, depending on the type of pain, right? Sometimes exercise can help build up the muscles around it and maybe help with a little bit too, as tolerated, right? So, and depending on what the prescriber recommends. They do have this weird thing called electrical stimulation. It's kind of like you put it over the spot that hurts and it kind of like sends tingles, weirdly enough, kind of to that spot and kind of distracts your body from the pain. It's very interesting. And then there is something, it's a fancy word, this osteopathic manipulative treatment, which I can't speak much to. I don't know much about it, but I know that there's certain ways that they can kind of help manipulate the body a little bit to maybe help with some of the pain. So I know that is some things that some doctors will do as well. But in the end, really, we want to make sure that you guys stay safe when we're on this journey of managing pain, right? When we're talking about pain management, making sure, right, we got to stay safe, right? Talking to your doctor before starting or stopping any medications is important. Using those 7 steps, so that was back, I think, on page 2. Using those 7 steps to describe your pain, super, super important. If you can follow those 7 steps with your pain and keep basically maybe like a pain journal of what it feels like, follow those 7 steps. When you go to see your prescriber, they're gonna much better have an idea of, well, what kind of pain was it? Maybe now I have a better idea of how to treat it, okay? Moving forward from there, just wrapping up as well. Always keep a list of your medications. Bring it to any visit you have with the doctor. Super important to know what you guys are on, to know what we're taking. Even over the counters, vitamins, herbals, supplements, always super important to know what you guys are taking. And store medications safely, as we talked about, right? Especially opioids, keeping them out of reach of children and things like that. So what questions do you guys have, just overall pain management wise, medication options, different things like that? What questions, comments, discussion would you guys like to have?